Hello, it's Tessa, one of the news editors here at Manx Radio. Have you been to the dentist lately? No, that's not a dodgy chat-up line, I promise. But have you? We've heard for some time now that getting in to see a dentist around the Isle of Man, particularly if you're an NHS patient, is becoming particularly problematic. For some patients at Hillside Dental Practice in Douglas, they've been waiting years. That, we understand, is because a dentist left, leaving their patient list unallocated. It meant that patients there could only receive emergency care. And the wait could go on after the private provider, Regent Dental Care, handed back its contract to Manx Care. It means from the 1st of December, the health body will take over the running of the Douglas practice. I spoke to Chief Executive Teresa Cope to find out why.
We obviously was aware that Regent Dental Care wished to hand back their contract and will cease delivering services from the 30th of November, maintaining a continuity of service and ensuring that we have a high quality service for those 6,600 patients who are registered with Hillside Dental Services was our priority. Now, what we didn't want to do was to not leave those individuals without a service. There was the option of trying to get someone else to take that contract with effect from the 1st of December. But in the same way as Manx Care made the decision to step in and run Ballasalla Medical Centre earlier on in the year, we felt this was a good option for Manx Care to consider. We took that through the board earlier on this week and have agreed to take on the running of Hillside Dental Services for at least the next 12 months. In the same way. So Manx Care will run NHS dental services. We will only provide NHS provision. We will work hard to get back on track. We know there has been some substantial capacity issues and there are a number of individuals who are waiting for their appointments and for treatment, and we want to secure and offer the staff working for Hillside Dental Services to transfer into the employment of Manx Care. So this is all the work that we're going to do at pace over the next few weeks so we can actually take over from the 1st of December.
You mentioned there that some of the staff will obviously move into Manx Care employment. From the practicalities of a dentist, does Manx Care have a dentist that it can kind of slot into this practice? How does that bit work?
So Manx Care already has dental services as part of its suite of delivered services. Obviously, the majority of our dental provision is delivered via our contracted services, but so in the same way, it's a very similar model to the model that is provided around primary care and GP provision. But this is a model that is open to us. We can run that practice ourselves, and that's the option that we have chosen to take forward. For at least 12 months, we will see how that goes. But, the important thing to sort of articulate to our patients is we are keen to keep a service running there. We are keen to secure and offer roles to all of the staff who currently work at Hillside and to be able to supplement that with our own staff who work in dental services. So be able to sort of enhance the offer in a similar way that we were able to do with Ballasalla Medical Centre by bringing other professionals who work as part of that team in to help with some of the capacity issues. We know that it is incredibly difficult to recruit dentists. But we're hoping we will be able to offer a high quality service at Hillside and get things back on track.
And you mentioned at the start that there's 6,600 patients that are part of that practice. I mean, we know from anecdotal conversations that we've had with some of them that they've been waiting some considerable time for their appointments. Do you know how many of those patients are actually overdue their routine checks?
No, not exactly. That's the sort of the due diligence and the work we're doing at the moment. So our teams are working really, really closely with the teams that are already in place there, understanding the position and being able to ensure that we put a clear plan in place to be able to catch up on all of the assessments and treatments and checkups that have been missed. So we've set aside time to be able to do that. As I say, it's early days. We've just made the decision at board level, and in the same way as we acted very swiftly to sort of transfer the Ballasalla Medical Centre, we will work quickly to ensure that we have as a comprehensive service up and running from December at Hillside Dental as what we possibly can.
And I'm sure that's going to come as a relief to so many people that obviously need to see a dentist, want to see a dentist. I'm guessing, though, that making this decision and taking this on isn't going to be cost neutral. Do we have any idea how much this is going to cost Manx Care in terms of stepping in to provide this service?
Well, we absolutely have to make sure it is cost neutral because there is no more funding in the system available. So what we're doing is taking the value of the contract and reinvesting that in the service. So we would ideally like to put more resourcing and more money into dental services, but that money isn't available at the moment. But what we can do is take the value of the contracts that we would have previously had with Regent Care and put that into the running of this service. And as I say, we are hoping to recruit, retain many of the staff that currently work there, and be able to build that service within the existing financial resourcing that we have.
Manx Care says it will contact patients to arrange their next appointments after it's set up its own booking software. The practice will be closed on Thursday the 30th of November and Friday the 1st of December to allow for the changeover to happen.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider so our best bits will magically appear on your smartphone. Thank you.